Hello, everyone. Welcome to Informed in 5. Today's guest is Damien Kinard. He has been a licensed physical therapist for 20 years and currently works at Elite Physical Therapy in Starkville, Mississippi. His experience includes proficiency in orthopedics, neuro, and aquatic therapy. Today, Damien will be talking about aquatic therapy and its many benefits. Thank you so much for joining me, Damien.
Thank you for having me, Brittany. So today I was going to talk about the benefits of aquatic therapy, which is physical therapy performed in water. And we have here at Elite Physical Therapy, we have a therapy pool. And several advantages and benefits of doing aquatic therapy. Number one is the temperature of the water. So we keep the temperature at about 93 degrees, and through that you get improved blood flow to the body. And so with that improved blood flow, you have just where the muscles move easier in the water and have can that benefit. Also with the water, you have what we call hydrostatic pressure, which can help with swelling. So if you have somebody getting in the pool that has any issues or conditions that cause immobility, and so there's a tendency for especially the legs to swell, that hydrostatic pressure of the water actually helps move fluid up towards the lymph nodes and helps reduce swelling. And also from a mobility standpoint, in the water, there's buoyancy, which is just the fluid assistance of movement. And so in the water, where someone, again, has immobility issues, so let's say if they were coming for therapy in the gym and have issues walking, with weight bearing, when you get in the water, you can significantly reduce the weight bearing. And so that improves mobility. And with that, it's still challenging because in the water you have drag resistance, which is when you're moving the body part through the water, you have that resistance. So a lot of times people think, well, if I'm doing it doing therapy in the water, it's not going to be hard and it's not going to really build strength up, but it's definitely the opposite. You don't feel the impact as much while you're in the water. And so, from a neurological standpoint, we do sensory integration in the water, which is really big especially with our pediatric neurological patients. Sensory integration is a big issue, and you help the water through just the pressure in the water. You have that integration of the nervous system, and so that will help kind of desensitize some areas where people have issues with real hypersensitive just skin, where not being able to stand touching and things like that. The water helps kind of relax the nervous system. Also, just some different ways we work in the water is where we have flotation devices. So if somebody's getting in the water and let's say they can't swim, we have several different flotation devices, from life jackets to we have pool noodles, and another really beneficial from a postural standpoint and positioning, we can have people in the water where we'll have them on their back, and again, having them move and going through a series of exercises, and where you have that gravity's eliminated and you've got the water that helps with the movement. At our pool here, we've got different levels, so people of different heights can reduce that weight bearing and pressure on different levels. We have an underwater treadmill too, so if it works out for somebody, they can actually walk on the underwater treadmill, and we can kind of work on gait issues and weight bearing issues too. Also, just some other benefits of doing in the water with the therapy is from a standpoint of cardiac output. So again, to get improved cardiac output, if you're exercising outside, you need to get your heart rate up to a certain level. But the good thing in the water, you have that improved blood flow, that improved venous blood flow, that you end up getting cardiac benefit, but you don't have to get your heart rate up so high. So just a lot of different we're looking forward, just advantages to doing therapy in the water for a lot of our patient populations. So, and I think as far as getting therapy, you just need a doctor's referral, and then I know Brittany's going to have our contact information up, but you just need a doctor's referral, and then you get an evaluation. If it's appropriate, we can get started doing aquatic therapy. So I don't know, Brittany, if you have any other questions. That's kind of a brief overview, but of the aquatic program.
No, I think that's great, Damien. You had some very useful information about the benefits and who can benefit. I think it's awesome, that y'all offer it for pediatric patients to come in. So yes, I will be including all of your contact information in the comment section and in the post for this video. So thank you so much. And if anyone has any questions, they can send them to me, or they can put them in the post. So thank you so much, and have a great day.
Thanks for having me.